Well, hello everybody, and welcome to Dr. McDougall's webinar today. The topic is the dietary treatment of cancer, and I'm Gustavo Tolosa, the moderator for Dr. McDougall's webinar. And today, I want to personally thank Dr. McDougall for taking time out of his very busy schedule to do these webinars. And I want to welcome you, Dr. McDougall. Please tell us a little bit about yourselves, because some people are new, and we can get started.
Well, thank you. Yeah, I am busy. We did this advanced study weekend with 300 people about a week and a half ago. Right now we're running a 10-day program at our clinic, and I'm taking care of a whole bunch of people, which is fun, doing lecturing. Next week we do a Whole Foods program. Whole Foods employees come to our clinic. Next week after that, we do a big program for another company. And then in December, we have another 10-day program in Santa Rosa. And then in January, we're taking a whole bunch of people to Hawaii. You're welcome to come. So yeah, somehow or another, they just keep me busy. I'm a board certified internist, a medical doctor. I have assistant professorships at 3 medical schools, which means nothing. I'm licensed in 5 states to practice medicine. I've been at this since 1968. I'm a regular medical doctor. I'm not an alternative medicine doctor. I'm not a holistic doctor. I'm just a regular conservative medical doctor who uses a good diet. And good diet's most of it. You can say good diet and lifestyle, but it's really just a good diet. Lifestyle may be exercise, which can be dangerous, and sunshine, which you can overburn yourself on, and good thoughts, which are kind of hard to gather, but it's really the food. So I use the food, and then I judiciously use medications. So what I want to talk to you about just for a few minutes, not too long. You can read about this in my February 2015 newsletter. The whole discussion is there in my February 2015 newsletter. If you want to learn more about my feelings on diet and cancer, very strong feelings, very scientifically backed, ones I've held for 35 years. There's a couple books you can read. They're on the internet, on our website, and also in used bookstores. They're called McDougall's Medicine, A Challenging Second Opinion, and Dr. McDougall's Program for Women. And they go into great detailed discussions of cancer. But there's plenty on my website. Just go to my website under Hot Topics, look under breast cancer, colon cancer, prostate cancer. You find all kinds of stuff. What I want to talk to you about is I want to talk to you about the dietary treatment of cancer. First of all, I'm one of the few doctors in the world that thinks diet has anything to do with health, period. Health, period, even constipation. To go so bold as to say diet has something to do with the cause of cancer really gets ears perked. And then if I went so bold and said the body never stops trying to heal itself, and if I told you that a diet can promote healing of cancer, like breast, colon, and prostate cancer. I mean, some of you out there would say, that's so novel. My doctor says diet has nothing to do with cancer. Well, I can tell you for sure, the body never stops trying to heal. And I've seen people heal completely when they've had a whole body full of cancer. Breast, colon, prostate cancer. So it does happen, and it's reported in the scientific literature, and you should never give up. In fact, I got interested. Let me just see if I can get to a slide presentation here quickly. I got interested in diet cancer, many, many years ago. 1984, I published a study on the dietary treatment of cancer. It was the first study ever published on the dietary treatment of cancer. It was on breast cancer, and it was published in 1984 in a journal. Well, let's see, what, a little too far there. Let's see if we get the journal up. The journal was Breast. It's Breast, 1984, volume 10. What I did is I took a group of women who had breast cancer, and I put them on a good diet. And what I showed is all prognostic factors related to living long were improved if I changed their diet with breast cancer. So I changed them to the diet I recommend, which is a starch-based diet with fruits and vegetables, no animals, no oils. They lost weight, their cholesterol went down, their estrogens went down, their prolactins went down, all things that favorably encouraged long and better life. And I published that in 1984 in a very obscure journal, and I'm sure people thought that I was, way too much. But anyway, so let's see. Then You look at the cancer statistics rates today. Do you see the cancer statistics rates? Gustavo, can you see that slide?
I can see that, yes.
Okay. This is the 2015 cancer statistics rates. It shows mortality starting from 1975, back when I did my study, to 2011. If you look at the bottom three bars, the blue, yellow, and kind of pinkish, you see there's been virtually no change in mortality. We're not improving the survival of people with breast, colon, prostate cancer. And that's what the cancer statistics show as of this year, 2015. Actually, I put them out in December 2014. So we're making no improvement over 40 years in terms of survival with all the big machines and the big chemicals and the big surgeries. Tell you the truth, those treatments really haven't changed since I was practicing. Remember, I published my study in 1984, and there's been no change in survival. People don't think about diet in terms of cancer. Well, think about it for a minute. Food is your most strong contact with your environment. Of everything you contact, it's food. So if there's going to be any possibility of influencing your body, you got to look to your food first. And first food was looked at in terms of cancer back in 1969. Dr. Dahl published a study where he found that the rates of cancer varied worldwide depending upon how rich a country was and how rich their diet was. And he and colleagues published studies way back then, what is that, 30, 45 years ago, showing things like this. These are various countries, and you see their total fat intake. That means animal and vegetable fat. And you look at their incidence of breast cancer. In wealthy countries like the United Kingdom, New Zealand, the United States, way up there on top, they have high rates of breast cancer. In countries like Thailand, El Salvador, Japan, where they eat a very low-fat, starch-based diet, very little breast cancer. And they sorted this data out a little bit. Remember, this was back in the 1970s when a low-fat diet was really a low-fat diet. You go to China today, and their rice-based diet is really a chicken-based diet and a beef-based diet. So this is data from 1970s. And they sorted the data out, and they saw that animal fat was a very strong correlation with breast cancer incidence country by country. And then they looked at vegetable fat. But you got to understand, vegetable fat that back then was vegetables, not corn oil. And what they found was there was a random distribution with vegetable fat intake. It was really the animal fat that was promoting the cancers. But I don't want to leave you off thinking it's just animal fat that produces and encourages the growth of breast and colon and prostate cancer. This is work that was published in the 40s and actually started in the 20s. This was by Tannenbaum. And Tannenbaum did animal studies where he'd take various animals and he would feed them different kinds of diets. And what he found was high-fat diets promoted cancer. A guy named Carroll, very important work that he did. You can look this up later, but it is important for you to know. He looked at the effect of vegetable fats, polyunsaturated fats, versus animal fats, which are saturated fats in terms of cancer promotion. Now, this may be too much for me to go through. But what he found, I'll just tell you quickly, what he found is that he grew the first three bars you see up there first, after the first two bars, the first three sets of bars, he's using animal fats. He's using a low amount of vegetable fat, very low amount, 3%, and then he's using a large amount of animal fat or saturated fat, coconut fat, lard, 20%. You see, you get very little cancer growth in those first three bars. Then what he does is he uses the coconut oil, but adds a little bit of vegetable oil, a little safflower oil to it. You see that fourth bar real high, lots of cancers. And the next one, a little bit of animal lard, tallow he calls it, and adds a little bit of vegetable fat. You see this tremendous growth of cancers. The point being in this slide is that animal fat alone doesn't grow cancer well. But if you add a little tiny bit of vegetable fat to it, then the cancers just go wild. The point being is everybody on the American diet eats a high animal fat diet with plenty of vegetable fat to give you this really, really strong encouragement of growth of tumors. You're all set up for tumors to grow. This particular research done in 75, it shows the number of tumor growths. Look at the top 5 bars. Those are vegetable fats. That's safflower oil, corn oil, soybean oil, olive oil, showing better growth of tumors than lard and butter and tallow. You see, these vegetable oils are very, very cancer promoting. As far as slowing down cancer, if you take the cholesterol out of the diet, which is the animal foods, you improve survival. Yes, you do. T. Colin Campbell says if you take the animal protein out of the diet, particularly the dairy protein, you stop the cancer growth. That may be so. Anyway, it's the animal foods and the vegetable oils that help initiate and promote the cancer. Probably some of the biggest initiators are the environmental chemicals that are produced by industry. And then once you get those chemicals in and damaging your DNA, then the animal fats and the vegetable oils really promote it, and the chemicals themselves promote it. All right, so now you got cancer. What do? You stop throwing gasoline on the fire. Yes, you do. And that's what makes the difference. I showed you the slide last time. I showed you how cancer begins, see the first single cell, and then it doubles every 100 days. So in 3.5 months, you got 2 cells. 100 days later, you got 4. 3.5 months later, you got 8, and so on. 2 years of cancer growth, you've got fewer than 100 cells in your tumor. And the tumor's lying in a mass like a breast that contains 100 billion cells. Well, at 2 years, if it's really cancer, it's already spread. By the time you can detect a cancer, it's been doubling on average for 6 years. It's 1 million cells in size, and it's 1 millimeter in size. At 10 years, when it's usually detected, it's 1 billion cells in content and 1 centimeter in size. It's the size of an eraser. Well, that's the natural growth, the average growth every 100 days. It takes 10 years to become detectable, but in certain circumstances, like if you eat an unhealthy diet, you make your doubling rate faster. So say instead of every 100 days it doubles, maybe it doubles every 28 days. And then you die fast. Now, if you eat a good diet, the doubling time slows down. Say it doubles every 300 days. Okay, you slow the doubling time. And then you die when you're 109 years old of breast cancer. That's the goal of treating cancer with a good diet, is you use a good diet to enhance the immune system to kill those cells, and a good diet that doesn't feed cancer. And as a consequence, you slow the doubling time. And in some cases, your good immune cells actually eat up the whole cancer and it disappears completely from the body. Now, this kind of idea I presented in 1984 with my paper on the dietary treatment of cancer. I showed you that when we started. That was wild news. Everybody that saw my work said he's crazy. But I want you to know, February 13th, 2015, the American Cancer Society came out and made it an official recommendation that patients with cancer should change to the type of diet I have been recommending to improve survival. Think about that. The American Cancer Society now officially recommends that once you get cancer, you change your diet because you will live longer. Isn't that amazing? And Standard Therapy for Doctors, a site called Up to Date, where doctors look for advice, same thing. They say if once you got breast, colon, prostate cancer, melanoma, or whatever you got, it's wise because you will live longer if you change your diet. A recommendation I've been making for, 40 years, since I published in 1984. The world is coming around. Amazing. People who have the whole body's full of cancer, there's just no hope, they say. It's a runaway train. Not true. Some people do get cure of their whole body full of cancer. It's called spontaneous regression. And I have a whole bunch of papers that talk about that. You can go to my February 2015 newsletter and read all kinds of references about people who've had cancer in their brain and their lungs and their legs and every place else, and it just went away. I have to challenge you with the fact that those people who get spontaneous regression are more likely to be in good health than bad health. And to get in good health, you need to fix the problem. And the problem is the food. So changing to a good diet, as the American Cancer Society now recommends, is a sensible thing to do when you're trying to fight cancer, slow the progress, and cure yourself of cancer. And that's what I got to say, Gustavo.
Well, thank you so much, Dr. McDougall. That it's very enlightening what you said about being in good health.
Yeah, good health is everything. And those of you who have cancer or friends with cancer, I know you're going for the chemos, which don't work in most cases. They do in a few cases, like childhood cancers and testicular cancers, lymphomas, and leukemias. But in most cases, these chemotherapies for breast, brain, colon, lung, prostate, these things are just brutal. And the harms done exceed the benefits in most cases. You really need to think about that. And the same thing with these mutilating surgeries, like amputating your breasts and high-dose radiations. You really need to think twice about these therapies and ask for conservative therapy, because these approaches do not cure disease. They may take care of local problems. They may slow the progression when you give chemotherapy a little bit. And the way chemotherapy works, by the way, and I'm going to throw you a big one right here, is the way chemotherapy works for breast cancer is it chemically castrates a woman. It kills her ovaries. And by killing her ovaries, which, by the way, you can do by just taking them out, or you can use a drug called tamoxifen or aromatase inhibitors, which blocks estrogen function. By killing the ovaries and decreasing estrogen stimulation to the breast tumor, you slow the growth and improve survival by 5 to 10% over 10 years. But excuse me, ladies and gentlemen, I want you to think about this. Poisoning a woman with chemotherapy, making her sick for a year and losing her hair is I think, a very cruel way of removing ovaries. You know, using the tamoxifen kind of drugs or having the ovaries taken out seems like it is a lot kinder therapy for a woman. So I don't recommend these chemotherapies for major tumors. But I do recommend diet. I've seen people with a whole body of cancer be cured. I'm not trying to tell you it happens all the time, but it does happen. Don't give up. It's the food. You need to eat the healthiest diet possible. Do we have any questions, Gustavo?
Well, we have a lot of questions, and what we're going to do is zero in the questions that are related to today's topic, and questions that are a little more general in scope, so that you can help the most people, the bigger number of people out there.
Well, let's see what you can grab out of your magic question box.
Yeah, let's put one topic to rest, because you get this question a lot, and people ask me as well. What about oil? Is one oil better than the other?
No.
Vegetable. So please tell us.
No, it'd be like choosing between whiskey and gin, or bourbon, or Marlboros and Chesterfields and Camels. These oils are toxic. What we're talking about is taking a perfectly good olive, which is high fat and fattening, but it's healthy, and sucking the oil out of it. And now you got olive oil. Or taking a perfectly good cob of corn and sucking the oil out, and now you have corn oil. You don't have corn anymore. Everything else is gone. All the fiber, all the protein, all the vitamins, all the minerals, all the milieu, the environment in which the oil sat. So when you strip the oil away from its natural environment, at best it's medicinal, at worst it's toxic. This oil causes blood sludging, which we may talk about later on. It makes your blood stick together, drops your oxygen content by 20%. What we talked about over the last couple of weeks is the fat you eat is the fat you wear. So if you eat olive oil and corn oil, you're going to wear it around your hips and your thighs and your buttocks. And as I talked to you about a few minutes ago, as far as promoting cancer, your vegetable oils promote cancer even more efficiently. In other words, they're more toxic than our animal fats. Vegetable oils cause gallbladder disease. They cause greasy skin, which promotes acne. This stuff is toxic. Stay away from it. You know, it's I just can't emphasize it enough. People get fooled. They think, well, I'm going to become a vegetarian and I'm going to eat olive oil.
Right.
Oh, you end up being a fat, greasy, sick vegetarian eating olive oil.
Exactly. And it doesn't matter whether it's grape oil or sunflower oil or olive oil, is oil.
Because it's all a non-food. You took the grape or seed and you strip the oil out, and now you just have you have a bottle of olive oil or grape oil. This is not an olive or a grape. This is oil. It's toxic.
Exactly. Okay. How about another general question that I think is interesting? Let's see who it was, if I can say the name. Sarah is saying, what about eating organic for prevention and treatment of cancer?
I think that's a good idea. A lot of the cancers caused today are from the chemicals that are produced by industry. These chemicals are cancer initiators and cancer promoters. Many of them have estrogen-like effects. They're estrogenic. Many of these chemicals are, and they stimulate estrogen-sensitive tumors like breast and uterus. I even remember just a couple of years ago, I was taking care of a patient with breast cancer, and she said, "Oh, by the way, we thought it wasn't really a problem, but my two sisters and I, we lived downwind from a factory that used to blow out of its smokestack all of this soot, and we were told it was safe." Well, all three sisters had breast cancer. You know, we were raised with the idea that these chemicals were non-toxic. I remember running behind the mosquito smog DDT truck at the drive-in theater, playing in the fog when I was a little kid, because everybody told us this stuff was safe. So these chemicals in the environment are extremely toxic, neurotoxic to the brain, cancer initiators and cancer promoters. So organic would be a good step, but a bigger step than organic is to eat low on the food chain. In other words, the real high levels of the chemicals are high on the food chain. They bioaccumulate. You get biomagnification as you move up the food chain. So when you start with the seaweeds and the grasses and the grains, they have low levels of these toxins. Then the fish or the cow or whatever animal comes and eats these plant parts that have a low level of chemical on them. And these are fat-soluble chemicals, so they get sucked up into the body of the fish or the cow or the pig. And then we come and eat the animal, and we bioaccumulate further because they're fat soluble. We suck up in our fat, and you biomagnify these chemicals 1,000-fold. And I just want to mention the last person on the food chain, that's baby sucking off mother's breast. And a mother dumps half her pesticide load into her breastfed baby within 6 months of breastfeeding. Yeah, organic's important. Eat low on the food chain. Eat a starch-based diet. That's the way to minimize your chemical intake.
Very good. Thank you, Dr. McDougall. Another question here is, if you're a patient, I guess maybe this question comes from a physician. If my patient is following a starch-based diet very strictly for a long time, and she is diagnosed with stage 4 breast cancer, what would you recommend?
Well, cancer starts, as I showed you before, it starts on average 10 years before it manifests, but it could start 20 or 30 years. So this patient who was eating a healthy diet may have actually started her cancer long before she changed her diet. What would I recommend if somebody had stage 4 breast cancer and was eating a healthy diet? Well, stage 4 means it's all over the body. It's in the brain, lungs, bones. It's every place. And I have taken care of stage 4 breast cancer patients. Ruth Heydrich, who you can study on my website, my February 2015 newsletter. She was stage 4 like 40 years ago when I met her. And Jessica Bowen, she was stage 4 when I met her 4 years ago. There are a couple of examples. All right, so what would you do if somebody is stage 4 and eating a healthy diet? Well, first of all, the treatments don't work. Surgery is not appropriate. Radiation won't do a thing. Anti-estrogen therapy may help, like taking out the ovaries or giving tamoxifen or aromatase inhibitors. That might help. Chemotherapy, as I told you, it works in a woman with breast cancer by chemically castrating her ovaries in a brutal manner. The breast cancer chemotherapy therapies they're barbaric, and except in very specific cases, they really do more harm than good. So you need to study that carefully. Now, getting back to your patient, she carefully follows the diet. Well, I hate to tell you, I don't believe it. I mean, that's the first attitude to take, not to offend the patient. But when people tell me they carefully follow the diet and I sit down and really ask them, they say, yeah, I don't eat any meat and only a little dairy. And yeah, I do put olive oil on my salads. And I eat out 4 times a week. And when you really get down to the basics, and also I know that because when I look at your patient who has stage 4 breast cancer, she's still 50 pounds overweight. How'd you get 50 pounds overweight following the diet I recommend exactly? In other words, people don't always understand or tell themselves the truth about what they're really doing. So what I would first do is I would think of any therapies that might do more harm than good from the standard medical business. And if they would do more good than harm, then I would use them. Totally independently, I would sit this patient down and I'd say, now look, this isn't working out and we need to be really, really strict. And I have 3 patients this month in my program I've had to say this to. They're kind of overwhelmed by all the cooking and everything. When I say to them, I look them right in the eye and I say, no, I know this is confusing for you, but you've got a daughter that's about ready to have a baby, and you got another daughter that's getting married next year, and you got this great family, you're a wonderful person, and you really got kind of dragged here, and you really don't know what to do and eat. So what I told her, well, all 3 of them, but I told this one in particular, I looked her in the eyes and I says, you need to eat sweet potatoes and water. That's it. That's all I want you to eat for the next 2 years, sweet potatoes and water. They got to be on a real simple diet. They got to end up real thin because fat promotes cancer, body fat does. And they got to be real real strict. And I have seen people, and it's published in the scientific literature. It's published in the Journal of the American Medical Association and various journals. I have seen people with a whole body of cancer get completely well. It does happen. It's more likely to happen in a healthy person who eats a good diet than a sick person who eats terrible.
Right, exactly. And Dr. McDougall, having been a person that in the past I have tried every possible diet and following them strictly, I understand that term following strictly can vary dramatically from person to person.
Oh, it does. It's a real communication problem. And it doesn't just happen between me and the patient. Even the patient doesn't really understand. So they're kind of still, well, as I say it crudely, they're still lying to themselves. And so to take some of that misunderstanding out and any possibility of error, I say, eat sweet potatoes and water. That's it.
Right.
And I really mean it.
Right.
Your life depends upon it. This person I'm thinking about right now, if she's alive in 3 months, it'll be a miracle. Oh, but I believe if she changes to what I say, she'll be alive in 3 years because I've seen it before. However, if I'm wrong, what's lost? She cuts her food bill by 40%. She has a good bowel movement. She gets off of many times. And I told her, as I tell other breast cancer patients, stop seeing doctors. Stop going in for the treatments and the tests. They're just hurting you. It's terrible what happens. All these follow-up visits and tests. What for? You've already cut my breasts off. You've already radiated me to pieces. You've given me 6 months of chemotherapy. Why do you want me to come back? What, you got some little hidden secret treatment you're going to share with me if I come back? Get away from these people.
Yes, thank you, Dr. McDougall. There are some people here in this webinar that are dealing with, or they know someone dealing with lung cancer, and they have never smoked. What are your recommendations regarding food for lung cancer?
Well, lung cancer, there's a variety of lung cancers. There's small cell cancer, which is related to smoking. There's a squamous cell cancer that's related to smoking. And there's also an adenocarcinoma. When you cough, you have mucus come up. Well, there are mucus glands called adenoglands, and they're in your colon and your cervix and many parts of the body. And so most people who get lung cancer that's not smoking related, it's due to these mucus glands. It's adenocarcinoma. And adenocarcinomas are due to diet, just like adenocarcinoma of the colon. So they really have a dietary cancer. It was caused by what they ate. Same thing with breast cancer and colon cancer. Same recommendations. Lung cancer is a disease you discover when it's near fatal. It's very difficult to cure lung cancer. I know some doctors think they do by cutting the cancer out. I think that's extremely rare that a person is saved, and many, 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 many more people are hurt by aggressive treatment in terms of surgery, radiation, chemotherapy. So you be careful. First, if you get cancer of any part of your body, you be careful and investigate and make sure the ultimate treatments are going to do you more good than harm. Just don't treat just for the sake of treating. Why add insult to injury? Why cut both your breasts off in spite of yourself? You've got to make sure that these standard therapies are reasonable. So stop. And one of the best advices I give to anybody who has cancer, and I consult a lot of people, is I say, stop right now. Take your time. You've got months to make decisions. You've got to study, get second opinions. This has nothing to do with diet. Take your time. This cancer has been growing for 10 years. So somebody with lung cancer, they need to eat a good diet. And I'll tell you something else. Let me just tell you a little side note here. There's an old friend of mine. His name's Ernst Winder. You'll find a audio that I did of him many years ago. He was my friend about 30 years ago. He's the man that discovered the connection between smoking and lung cancer. He went to Sloan Kettering back in the 1950s, and he said to the experts at Sloan Kettering, Ernst Winder, very famous, very brilliant scientist, he says, smoking causes lung cancer. And they said, nah. He says, yeah, you stick this tube of tobacco in your mouth, you suck it in, you get lung cancer. He says, nah, couldn't be. Well, anyway, about 4 years later, he went back to the same medical experts at Sloan Kettering, Ernst Winder did, and he says, you know, what you put in your colon causes colon cancer. They said, nah, how could that be? He says, yeah. Anyway, Ernst Winder was an amazing researcher. He was my friend. And one of the things he discovered was that women who get breast cancer in Japan live much longer than women who get breast cancer in the United States. And that's because in Japan, they were eating a rice-based diet with very little meat and oil. The other thing he discovered is that people who got lung cancer in Japan, 60% of the Japanese males smoked back then. People who got lung cancer in Japan lived much longer than people who got cigarette smoking related lung cancer in the US. And the reason is, so you take this noxious substance, this poison, you suck it in your lungs, it damages your lungs, your body tries to defend and repair the best it can. If you're eating the American diet, it doesn't have the strength. It's sick. It can't defend and repair as well, so you get more lung cancer, you die faster. If you smoke cigarettes in Japan back in the 1950s and 60s, you were on a rice, vegetable-based diet, very little fat, pretty much close to the diet I recommend. And you smoke cigarettes, you damage your lungs, your body has the ability to defend and repair because it's healthy. So your diet affects skin cancer, lung cancer, cigarette smoking, lung cancer, brain cancer, everything in terms of getting the cancer and how it progresses.
Right, right. Thank you, Dr. McDougall. I just want to mention that a lot of the questions that you're answering here are included in your Starch Solution book, which I would recommend everybody to get a copy of.
We are assuming that people know who I am and that our website is www.drmcdougall.com. And it's a website that's filled with literally thousands of articles that all are free. The website is free. Just go there. You'll find my color picture book that tells you, without even reading, just looking at pictures, how to do the diet. And old books that I've written. I've written 12 or 13 national best-selling books. About 6 of them are still on the market. You can buy them in the bookstores. Penguin Putnam still has 4 books actively sold after 20 years. We have Rodale has my newest book for sale. Anyway, there are about 6 books that are actively being sold, which is a big deal for a book to be actively sold that long. And then there are about 6 books that are on my website that you can download as PDF files. They cost $10, but they're PDF files. You can buy them in used bookstores for 50 cents. Yeah, there's all the information I'm telling you is on the website. And remember, my February 2015 newsletter is all about diet and the treatment of cancer, and it tells you that the American Cancer Society now officially recommends that people who have cancer change their diet, and it will cause them to live longer.
Exactly. And Dr. McDougall, I know that there are people that are disappointed that because for one reason or another they cannot attend your events in Santa Rosa, but please know that everything, just about everything that you do in those programs is free on your website. You're doing a great service by putting this free there on your website. We
have experts and lectures, and you will spend, conservatively, you'll spend $300.
Oh, yes.
For the free stuff. And I'll tell you why we put it free, just in case anybody wonders, is that my wife, Mary, and I were given this great gift about 40 years ago to not only save our family's health with a good diet, but for me to have a very satisfying practice where my patients get well. And so I always had the attitude, and this helped maintain that attitude, that when you give, you get. And so ever since then, we've begun giving everything we possibly can away. Well, we don't give our trips to Hawaii away, which we're doing in January. You have to pay for that one if you're coming to Hawaii with us. or your 10-day program. You have to pay for that, or the advanced study weekends. I mean, seriously, we do have a business. But if you have a problem and you go to the website, you search under hot topics, or you use the search feature, and you put in whatever is troubling you, you'll be amazed at what you get. I hold nothing back. It's all there. It's free.
Exactly. And someone is asking about mammography, Dr. McDougall, but you covered that extensively in last week's webinar.
Mammography, and if you go to my August 2014 newsletter, you'll have my recommendations on early detection screening. What I recommend is one stool exam around age 60, like a stool for blood or a Cologuard test. Can you hear me okay? Yeah, okay. Or a Cologuard test, or a sigmoid exam. I do not recommend colonoscopies. They're too risky for the benefits that you might gain. If you have a colonoscopy, think about it. You're risking your life today for the theoretical possibility that you won't get colon cancer and die of colon cancer in 10 to 30 years. People have their colons perforated. They die from this treatment. It is a dangerous treatment.
Right.
So I don't recommend it. You can get good. Okay, I recommend Pap smears between the ages of 21 and 50 for sexually active women. You get them done every 3 to 5 years if you have a uterus. I recommend the dentist or hygienist looks in your mouth for leukoplakia, and I recommend you do kind of a casual look at your skin. I recommend against breast self-examination. I recommend against, listen to this one, Gustavo. I recommend against prostate self-examination. Oh, they're all smiling now. I recommend against mammography, against PSA testing. This is disease mongering. These are doctors and companies coming out looking for you and your family to get you in the medical business.
Right, looking for
most of it more harm than good.
Right. Dr. McDougall, someone is asking if you would please comment on lymphatic cancer.
Well, that's those lymphatic cancers, and what I think they're talking about is lymphomas. Okay, if you're lymphomas, we have some treatments that work pretty good for lymphomas. Lymphomas, testicular cancer, leukemias, childhood cancers, we have some treatments that work pretty good. It's mostly the solid tumors I'm talking to you about that we have such a terrible job.
Right.
And these lymphomas are caused, I think they're caused by eating animal foods, particularly beef.
Exactly. What about fasting for cancer cure? Any comments about that?
Well, I don't know much about that. I have friends right down the street at True North Fasting Center, good friends, and they do that. I would look into True North in Santa Rosa, California, but all I know about is people who have been fed. But, I wouldn't doubt that fasting has been of great benefit. I read stories about it. I certainly would look into it as part of my exploration to get well. Ladies and gentlemen, when you walk into the doctor's office, well-intentioned as she or he may be, they have treatments that are mutilating and toxic. Radiation and chemotherapy and surgery are brutal. Okay, brutal is okay if benefits follow, but the benefits don't follow. They do, but not the benefits you want. You're going in for a cure. You're going in for a better life. And what you get is you get a stiff, leathery breast after radiation. You at least double your risk of dying of heart disease if the radiation is on the left. With chemotherapy, you lose your hair, you're sick, you compromise your immune system, and you may even increase your chances of dying from not only the cancers but infections that follow. These surgeries they're doing. I've been reviewing my life here lately, and I've been involved in breast cancer surgery, well, since the late 70s, early 80s. I actually got the third informed consent law passed in Hawaii, which required physicians to tell women that they have options when it comes to breast cancer treatment. By law in Hawaii, they had to tell women back as early as 1982, they had to tell women if they had breast cancer that they could have a lumpectomy plus radiation, a mastectomy. They could have or not have their lymph nodes removed. They even because I had so much to do with this law. They even asked me to write a little piece in the brochure, which I did, which says after you get breast cancer, you should change your diet. And that was back in 1982. Now at least 18 states have laws that or doctors must tell women about their options. Now, I thought back in the late 70s, early 80s, because all the research had been done. There's no other research that has been published of any significance in terms of surgical management of breast cancer. I thought back then this brutal, criminally brutal therapy of amputating a woman's breasts would disappear and be laughed at our time in 2015. I thought they'd look back at that and I would say it's as bad as leeches, but leeches aren't so bad. What would be as bad as? I can't think of anything as bad as amputating a woman's breast when we know it doesn't work. But it hasn't changed. They're doing just as many mastectomies. They're doing lumpectomies, always giving radiation. This stuff is unnecessary. It's overkill. The benefits are better local control, but no improvement in survival. Every doctor knows this. And the fact that they continue to practice this way, in my humble opinion, is criminal.
It's appalling.
Did I say that on internet? Did I call this behavior criminal on internet? Maybe somebody will hear this. Maybe a doctor will hear this and will respond that Dr. McDougall thinks that his or her practice of mutilating women with amputations of the breast and all these other treatments are criminal. You see, I'm going to end with this, Gustavo, because I'm starting to get a little crazy now.
Yeah, right. So
people who steal your money and hurt you are known as criminals. Yes, they are. Oh, let's go on to another subject.
Exactly.
I don't want anybody to get a bad opinion of me.
We can all forward this webinar to some doctors that we all know.
Well, you tell them exactly what I said, and I'd be glad to talk to them about it.
Right. Everybody.
What usually happens, I'll tell you what usually happens. I never get a confrontation. You will not have any physician.
No.
You can write on my discussion board where everybody can see it. You'll have no physician go to the discussion board and call me out as misinforming you or lying to you or exaggerating. No one will do that. They may say behind my back, oh, that Dr. McDougall, he's kind of a goofy guy. But they're never going to say that because they know I'm right. And that's just the way it is.
Yes, exactly.
Doing what they do, even though they know what the truth is. And do you know why they keep doing what they do? Because that's how they were trained.
Right. Exactly.
And that's how they put shoes on the kids and pay for their automobile payments. I did. Will you let me go just 30 seconds here?
We'll let you go. Yes.
There was a guy surgeon back in 1979. His name was Kim. It was a Castle Hospital in Hawaii, in Kailua, Hawaii, Castle Hospital. That's where I was working. And Leonard Kim was a friend of mine. He was a general surgeon. And he presented a noontime conference on mastectomies, showing that this kind of, amputation surgery did not save lives. And he got done with the lecture, and I walked up to Leonard. And I said, Leonard, you just gave an hour-long presentation reviewing the studies showing that mastectomy did not save lives. Did I hear you correctly? He says, yeah. I said, Leonard, I have the surgical schedule in my hand here. It says you're doing 2 mastectomies this afternoon. Is that correct? He says, yeah. I said, why are you doing that when you know it doesn't work? He says, John, that's the way I was trained. And I said, Leonard, what's going to stop this? And remember, this is 1979. And Leonard said, and remember, Leonard's my friend. He says, John, a whole new generation of surgeons trained differently. Well, excuse me, it's 2015 and they haven't been trained differently. I don't get it.
Yeah, it's there's no answers. I don't know.
I don't know. I keep thinking that the truth will surface, and
exactly.
But the money's always got it. The money always wins.
Dr. McDougall, just very quickly, would you comment on the Hodgkin's lymphoma, if you have had any? Well,
I don't have a lot of experience with Hodgkin's. My recall is that chemotherapy is an effective therapy. Remember I told you lymphomas, leukemias, testicular cancer, childhood cancers, we have some pretty good therapies. I believe Hodgkin's lymphoma is caused by the Western diet. What part of the Western diet? It could be the lymphoma and leukemia viruses that are transmitted from cows and pigs and chickens to people. So these viruses causes cancer, just like with your cat. Your cat gets feline leukemia, and so you take the cat for a feline leukemia immunization. Well, people get leukemia and lymphomas from viruses too. And then there may be other aspects of the Western diet, like the high animal protein intake, which may wear down the lymph system, and the fat and the lack of good stuff in the diet from vegetables. But I would look to the diet and which component causes it, the viruses, the chemicals, there's where you look to the cause to get the cause.
Right, right. Well, I know you need to go. You're running the 10-day program this week.
We are. I've got a whole bunch of people I'm taking care of with, just amazingly nice people at our 10-day program. And
yes,
I get to go in and touch them and talk to them. So
it is a
looking forward to that
program. Thank you for doing that. And everybody, thank you for logging in today. This webinar and past webinars are all available for free for you at drmcdougals.com under the education tab, and then under the free webinars. So this one is going to be posted in a couple of hours.
Yeah, show it to your doctors who do cancer treatment.
That's right.
What they think. Yeah, I'd like to hear from them. I've been waiting for 40 years to hear from them.
Well, maybe you will.
I think they're just too busy doing their mastectomies and prostate removals and running to the bank to give me a call. But I'd like to hear from you. I really would.
Doing what they've been trained to do, like you said.
Yeah. I'm getting old, and pretty soon I'll be so old you can beat me, but right now you can't.
You can't.
All right, Gustavo. Thank you very much for your help, and I hope everybody enjoyed the time together. We're going to try and get together every week for as long as we can, talk about many, many different things.
Very good. Thank you again. Goodbye, everybody.
Bye-bye.
Okay, bye-bye.